morning, ladies and gentlemen, and welcome to Hashtag One with You, the PLDT Enterprise Virtual Forum in partnership with Salesforce for the healthcare industry. This is Monique Dela Luna from PLDT Enterprise, and it is my honor to be your host for this morning. To all those who are tuned in, we truly appreciate you taking the time to be with us in this session. This morning, amidst this pandemic, we will get to hear key learnings from our roster speakers as well as share back best practices on how the healthcare industry has managed to mitigate the negative impact of this crisis situation. And most importantly, this session aims to highlight the role of technology as we enter the future of work, as well as how we navigate through our daily lives. If you have any questions and suggestions, feel free to key them in through the chat box. But before we begin, here is a quick rundown of our reminders. For uninterrupted viewing experience, make sure you have a stable internet connection. Feel free to use any device to view the virtual event. For better appreciation, turn up the volume or use your headphones. And please switch off your camera and mute your microphone during the session. And now, to officially start the program, our first speaker is an economics graduate from Wheaton College in Norton, Massachusetts, with a master's degree in business administration from Ateneo Graduate of Business School. He has been with PLDT Group for 12 years, starting as a relationship manager to being the youngest ERM head in PLDT Enterprise. He also joined SPI Global Inc. as head of IT service operations and transformation for Vietnam, China, India, and the Philippines. With experience in the BPO, conglomerates, and healthcare industry, and currently the Vice President and Head of the Customer Relationship Management Group, let us all welcome him on screen, Mr. Luigi Casas.
Thank you, Monique, and good morning, and thank you all for being with us today for our One With You virtual learning series. When the country went into lockdown in March, one of the major industries that was affected was the healthcare industry. Not so much in the form of physical hospitals being overwhelmed by the number of patients, but also in terms of reach and accessibility of nurses and doctors to the public. Consider this. There are approximately 90,000 registered nurses and around 45,000 licensed doctors in the country. But also take into account that we are a population of around 110 million Filipinos spread across 7,700 islands. These numbers were consistent even before the COVID pandemic began. How then can we ensure that everyone has access to the right healthcare at the right time in this day and age where people are scared to go out of their homes or they're scared to visit hospitals due to the virus? So since the start of ECQ, the PLDT Group has been assisting both the public and private sectors of the healthcare industry in the forms of connectivity, cybersecurity, infrastructure, data management, and telemedicine solutions. These virtual learning series aim to share the best practices and solutions that can help you in a post-COVID world, as Monique mentioned. For today's session, I'm excited to introduce our partners from Salesforce. Today, we will see how Salesforce has been able to transform the healthcare industry through their Healthcloud service and their telehealth solutions. Before we see the Healthcloud service and what it can do, here to discuss the partnership between PLDT and Salesforce, I would like to give the floor to IPC's Nino Belmonte. Nino has had over 20 years of experience in marketing and branding, particularly in the IT and telco space. As Director of Marketing and Digital Innovation at IPC, he oversees the company's product lifecycle, brand equity, partner relations, and marketing communications. He is currently the head of Cloud Apps, Business Development, and Industry Solutions in ePLDT's disruptive business. Nino, the floor is yours.
Thanks so much, Luigi. Good morning, everyone. First of all, I'd like to thank you guys for taking the time out to join us today. I know that particularly in the healthcare sector, things are quite hectic and quite busy, and we truly appreciate you allotting some time to join us this morning. So let me just quickly share my screen here. So today we'll be talking about Salesforce, right? So Salesforce is indeed the number one CRM in the world. This has been proven year after year by third-party, organizations such as Gartner. And Salesforce has been in the Philippines for well over a decade, enabling customer success through its partnership with IPC, which is the subsidiary of EPLDT. So I just want to make a quick introduction about our Salesforce initiatives here in the Philippines. Before I start, I'd like to introduce you to the CEO and founder of Salesforce, Mark Benioff. Unfortunately, he could not join us today, but he did leave us a message, which is this: you need to get to the future ahead of your customers and be ready to greet them when they arrive. So quite profound. No? So this is exactly what we're going to be talking about today, how we can prepare to better serve our customers by taking a peek into the future and finding out the possibilities and what different capabilities our organizations can have in terms of assisting, I guess, patients all over the country. So yeah, Salesforce has been around in the Philippines since 2007 through its partnership with IPC, as I mentioned. So it's been a long journey, and today we're essentially going to market with something that we believe is a game changer, particularly in the healthcare space, where at this point in time is quite important and quite urgent. It's a snapshot of the customers that we are currently supporting and enabling. You'll see here that I guess our largest healthcare customer today is the Medical City, which recently signed up for Salesforce for various facets within their operations. So as a Salesforce consulting partner, EPLDT is not simply just reselling a product. No, this is not a business wherein we simply take a software license and sell it to the customer. We have capabilities to do implementation, migration, configuration, and all of these other professional services. And we're also able to provide managed services to help customers to continue using their newly implemented application, and I guess also spark adoption within the organization. We're building the capability around every facet of Salesforce that touches the customer, and we specialize in implementation, migration, change management, deployment services. We handhold with the customer every step of the way, so that adoption is high and that the continued, I guess, effects of Salesforce can be felt. All right, so I'd like to leave you with this quick video about Salesforce Healthcloud. Let me know if you guys can catch the audio.
With the Salesforce Health Cloud platform, provider organizations can build stronger patient relationships and create personalized engagements on a connected care journey. You can create personalized communication journeys to increase awareness and reach new patients on any channel. Service agents can easily review all open cases and tasks with pre-built workflows to help guide calls, while seeing all relevant patient data from multiple systems on a single screen to quickly connect patients to the right care faster. Then, make every interaction an opportunity to offer proactive support with intelligent recommendations to increase patient loyalty and satisfaction. Care managers can see their assigned patients and prioritize tasks from the Today page and review rich, contextual information on each patient. By connecting data from electronic health records, care pathways, patient preferences, and more, you can reveal intelligent, actionable insights with integrated AI. Create personalized care plans with measurable goals to drive engagement, and review the health timeline to see a complete view of the patient history, including clinical and engagement events. Wearable device data is integrated directly into Healthcloud, so you can access relevant patient data like glucose levels to inform smart care decisions, and collaborate with the care team, all from a single profile. Then, guide patients to better health outcomes by giving smart, simple, and personalized engagements where they can view helpful reminders and complete assigned tasks with access to resources and their care network on any device for improved adherence. Visit Trailhead to get started and see how to connect the patient experience on the journey to better outcomes. Blaze your trail with Salesforce.
All right.
Okay,
There you
thanks,
have it.
Nino.
That's it for me. Thanks so much.
Got it. Just a reminder, if you have any questions and suggestions, feel free to key them in through the chat box and we'll address them during Q&A segment. So our next speaker is a graduate of business management from Sambeta College and earned his master's degree in business administration from De La Salle University with 25 years of experience in the field of customer service, sales, and business development. 12 years of his career was with a service provider including PLDT, where he managed conglomerates and large BPOs. He moved to Cisco in 2009 as country sales manager for Cisco's collaboration business in the Philippines. Currently, he is the regional manager in Salesforce for Service Cloud business, managing Southeast Asia for SME covering different industries including healthcare. He established a strong relationship with the CXOs and actively participating in industry associations as evangelists, providing exceptional customer experience with business results. Let us all welcome Gerard de Guzman.
Thank you, Nick, and good morning to each and every one of you. Let me just share my screen. So just before we get started, Salesforce is a publicly traded company, so we need to show this notice to you briefly. Just a quick reminder that customers should make buying decision only on the products commercially available. So we understand it's a tough period for many organizations right now, particularly in the healthcare and life sciences. So we really want to thank you for all that you're doing on the front line through this crisis. Me, myself, I have 3 sisters in New York who are part of the front lines together with their husbands, one in Texas. So I really understand where you're coming from. Every time that we're having a discussion, asking how they're feeling right now, and me myself, I can feel the pain. I can feel the challenges, and that's why our hearts is with you right now. And thank you for all that you're doing on the front line through this crisis, as well as your time spent with us today. We hope to make it's really valuable use of your time. Something that we really believe at Salesforce is that one, the key to all our success is our shared values. So this is just a snapshot on who with Salesforce as a whole. Earlier, Nino mentioned about some of our customers here in the Philippines. So we have Medical City, but just to share with you who are with us from the field of providers, healthcare providers, from the field of payers, medical devices, and pharmaceuticals. So these are what we call part of the Ohana. These are part of the family of Salesforce who's been with us. And as we share their success as well on how they continue to establish their relationship with their customers. So we are in the midst of an unprecedented crisis that is not only taking a toll on the public health, but it's also causing serious economic consequences across the globe. And those macroeconomic hardships are affecting every business in different ways. Our offices, and of course, we know that schools will be open up by August. Some businesses may be shutting down. I was in Alabang Town Center yesterday. I really felt the hardship of those small businesses, while others are trying to ramp up to meet new unexpected demands. So the questions that I would like to ask from the audience in this session is, how has your business been affected? So feel free to chat, to share your thoughts in the chat room, and probably later on, I would like to see how can engage with you moving forward. So what is the impact to our customers? So influx in call volume. So I understand that I spoke with three weeks ago or 4 weeks ago. I started engaging with the Department of Health and even with some of the local government here in the Philippines, and they continue to get a lot of inquiries, calls, and those are the influx of call volume, especially in the areas that are most affected. Healthcare providers and insurers are being overwhelmed with inbound calls and cases. So here in the Philippines, even MaxiCare, who's an existing customers of ours, are really asking how we can help them in this pandemic. And they continue to provide, even though COVID-19 is somewhat new, they even provide assistance to the member of MaxiCare. On top of this, some call centers and staff are fielding questions out of the typical scope of patients, right? So patients' clinical condition in these impacted areas. These are also disruption to elective specialty services or beds. How many beds are still available and so on and so forth. But of course, we understand that with the partnership with our government together with the private sector, we manage to open up a lot of places where we can help those COVID-19 patients and suspected patients as well. And of course, aside from the healthcare provider, the impact to the medical technologies, we are aware that there are cases that some of the procedures have been delayed. There are pregnant who opt and choose to, give birth in the comfort of their house. I hope it's comfort in their house, but really a lot of things are changing, right? So new models and channels for engagement has been changing, catering to both surges and delays in their care requirements. So, and of course, not to mention, last but not the least, are the patients themselves. So the senior citizens who are still not allowed to go out because there are vulnerables. The people who live in the nursing homes. We know that in the US, most of the affected patients are from the nursing homes. And these are the things that we want to make sure that we continue to protect them here in the Philippines as well. Or even the children with chronic diseases or moderate to severe asthma, and the people with serious and underlying conditions are at the higher risk to COVID-19. So just even before the COVID-19, just to give you a snapshot in terms of the numbers, 83% of patients say it's important that providers know them personally, right, beyond their medical records. 68% of patients expect engagement in real time. So from the provider organization, consumerism needs to be top of mind. We know from our own research that patients' expectations are changing and that patients are inclined to leave their provider if their expectations are not met. So as we begin to think about what the world will look like as we emerge from COVID-19, we can turn to pandemics of the past to inform our steps forward. From SARS, health, or crisis, me, myself, as you may aware or heard from Monique, I am managing even Thailand. And I've heard that one of the reasons why Thailand managed to contain COVID-19 because they're still using the same tried and tested blueprint, what they've experienced from SARS as early as 2003. So which is one important thing to learn from them is the contact tracing. So they continue to use it. So, and tech companies right now grow stronger in the aftermath and ultimately permanent shape e-commerce like China and around the world. Similarly, customers will need to identify their own prevailing trends in the wake of COVID-19 and realign their business priorities accordingly. As the rise of consumerism and digital tech accelerated by this pandemic, including pharmaceuticals, right? So just to give you a snapshot, this is what's happening. I opt to pick Indonesia because I believe that Indonesia is closer to our within our country and closer in terms of our culture as well. Not to mention in terms of the population. So Indonesia, as late 2019, they're starting to shift their gears, moving toward telehealth. So major Indonesian hospitals go digital. The top, they're providing telemedicine. So consumers expect to increase their use of digital as well as consumers are increasingly interested in preventive health, convenience, and ownership of this care. So these are available information and data that you can see as part of what Indonesia have shared regionally and globally. So even myself, so just to share with you, I'm a father to a son who has a mild cerebral palsy, and me myself, I'm always worried because I want to make sure that I always bring my son to the hospitals so that they can be seen by the doctor periodically. But a good thing that my family doctor has managed. I managed to get his schedule, and even ask my family doctor to visit me and my family so that we can have a flu shots. We understand that this flu shot is not yet for COVID-19, but at the end of the day, I want to make sure that I continue to protect them. But the question is, how can we protect the rest of the patients in this country? Do they have the luxury of time? Do they have the luxury of bringing in the medical doctors, the nurse, even the med techs in the comfort of their house, right? So these are some of the few use cases. That's why I think of it. What happened to our citizenry? Do they have access to this kind of solutions? And this is the reason why even myself, me from Salesforce, I took the opportunity of engaging Department of Health and providing them the tool. And I'm really looking forward to hear from Department of Health how the tool is helping them in terms of contact tracing, in terms of understanding the patients, and so on and so forth. And this is in partnership with EPLDT, PLDT. So moving forward, the one common theme that we've heard from every customer is the shift to digital is more important than ever before. The needs to happen quickly. It's now. It's imperative. And many businesses are also shifting to digital for employees as their entire workforce shift to be working remotely. We have been staying very close to all our customers like healthcare providers, medical technologies, and payers, and even the pharmaceuticals company. And we hear a few key things from them, directly from the leaders who are trying to sort through the challenges. We're hearing these key issues are top of mind for businesses. And what are continually hearing them say is they think through all of this disruption and they think need to tackle. And the transformation is to be agile and it's need to happen right now. During this crisis, we've discovered that companies move through three stages of response. One is to stabilize your company, back to work, and eventually, when we emerge from this crisis, is grow your business. Companies are going through these phases at different rates, and your company are not exempted. You company most likely have its own pace, and we are here together with our partner. We are here how we can help you. We can sit down and let's talk. So we have the knowledgeable team with clinical experience that knows the ins and outs of care delivery intimately. We marry our medical backgrounds with technological innovation to meet patients where they are and the personalized manner and the most preferred. And this is the reason why I would like to share with you, introduce to you, the shift of digital is happening quickly. And that's why Salesforce created what we call Patient 360, a completely digital first platform to meet the needs of digital imperative. At the core of the Patient 360 is your customer patients, who is now completely digital. We believe that everything should be centered around our patients or your patient. That way, your sales, your service, marketing, analytics, everything you do is centered around the patient's need. And this is why I would like to introduce to you connect to your patients with Healthcloud. This is what our partner we're going to share with you as what Nino mentioned earlier. Salesforce empowers provider organization of all sizes and types of delivering personalized, collaborative, and connected care. Attract more patients with personalized journey. Simply access to care, engage care teams anywhere while building one-to-one relationship across entire care journey. And with healthcare, we have part of the solution is what we call Lightning Scheduler. Lightning Scheduler empower your health consumers to schedule medical to non-medical appointments like health education, wellness, coaching, or to reserve medical equipment, resources with care conditions and professional at the right time, location through pre-built flows and conveniently self-service. Self-scheduling interface save your employees time by facilitating self-serve scheduling into your portals, website, and app. So this will allow your organization and the patients to practice social distancing because patients doesn't need to go to the clinics or to the hospital without getting the actual schedule to their doctor. And not to mention, aside from getting scheduled to the doctor specialist, we can do schedule of their asset as well. So easily book and manage internal healthcare resources like rooms and equipment with asset scheduling. Reserve assets like MRI machines, X-rays, dialysis chairs, and rooms with existing workflows. And again, intelligent scheduling insight to optimize asset utilization. But as what is important is we know that, like for example, my son, he has a mild cerebral palsy. He's on a wheelchair. He cannot go to the clinic. I will not bring my son. But if there's an availability for bring the specialist, to bring the expert, to bring the laboratory in my house, I will do so. And this is not new because in Salesforce, we have what we call field service integration with Healthcloud. So field service enables you to manage a mobile workforce delivering the service in patient's home or in areas across your facilities. With field service lighting in Healthcloud, field care providers have access to patients' data and are able to interactively update goals, tasks, patient's care plan from the mobile Android or iOS. So the mobile health care will be given those different tasks that they need to complete. They may be new, novice, or expert. At the end of the day, it's about the different tasks and instructions that they need to complete based on the current use case of their patients. So we want to make sure that this will be practiced even though they're outside of their clinics or hospitals. So bottom line, it's about delivering virtual healthcare, or may it be delivering the healthcare at the comfort of their house. Through Salesforce Health Cloud, Lightning Scheduler, and Field Service, your organization will have the ability to deliver a hybrid to virtual care to your patients. And this is not something that we need to develop because this is already available. This is the snapshot of the solutions available right now. And just to share with you, Stanley Healthcare, we have a use case that are tried and tested. And a quote from Stanley Healthcare that Salesforce enables them to have a tighter, long relationship with their patients by putting them at the center of their business. So we have a different blueprint, my dear audience, from mental health. So these are the snapshot, integrating with payment, integrating with virtual healthcare, integrating with video conferencing. So the same case with mental health, primary and chronic care. It's the same. It's the same algorithm. It's the same flow that we can apply. And at the end of the day, we can also apply this to the likes of virtual health, as I mentioned earlier, for pharma, for med development, and so on and so forth. So these are the three blueprints that we can easily discuss and share with you. Just chat us and let me know how we can help further, right? So without further ado, I'm gonna bring the screen to Monique so that we can give you the platform or the session in action. So thank you, Monique. Back to you.
Thanks, Gerard. It was very insightful. So up next is the IPC Solutions Consulting Group Head to demonstrate with us the capabilities of telemedicine and e-prescription functionality of Salesforce Health Cloud. Let us all welcome on screen Ms. Tony Samonte.
So, hello everyone. My name is Tony Samonte. I'm the technical consultant lead for application services COE here in EPLDT. So, my role here is to provide you a brief demo of Healthcloud. So, just to set the tone, I'll be introducing you three of the personas for the demo. So, the first person would be Charles Green, my uncle. So, me, Charles Green. I'll be booking an appointment on his behalf. Then we have Dr. John, the primary care physician, as well as Melinda, the case and care coordinator. The demo flow will be as follows. So, on behalf of my uncle Charles Green, I will be the one to book an appointment for him using the self service portal. Then, I will be showing you the care coordinator's view. So, Melinda will go ahead to create the WebEx meeting link. Then next will be the patient interaction with Dr. John, myself, and my uncle Charles. Then I will show you another video conferencing tool called SiteCall. Lastly, we'll show you what the console looks like when we are trying to book for a physical therapist near Charles. On a browser, this is how the self-service portal would look like. So I'll be switching to the mobile version of this self-service portal. So here you can actually see that I can log into the system and I can actually see my medical records. Okay, so there you go. So that's this feature. But our main purpose is actually go ahead and schedule an appointment on behalf of my uncle Charles. You can actually do a self schedule appointment online, or you can opt to call or chat to a live agent. Okay. So, but for now, I'll be scheduling an appointment for my Uncle Charles using the schedule an appointment button. Okay, so I'll just click on the care and consultation and then click on follow up. Then I'll go ahead and click on next. Click on the virtual meeting because that's what I intend my Uncle Charles to do. Let's go ahead and type in the location, my location, then the virtual meeting, and then click on next. Okay, let's go ahead and click on the schedule. So let's just say I want to schedule for, yeah, for Tuesday at 9 a.m. Okay, so I'll click on next. Then I'll go ahead and type in my uncle's name. Okay, so there you go, Charles Green. Email, let me just put my email for now, as well as my phone number, since I'm assisting my uncle. I just can leave the company blank and subject back pains. Need consultation. Okay. Okay, so my schedule will be on Tuesday, June 16, 2020 at 9 a.m. Then I click on next and it should be creating an appointment for me. So finish. We switch to Melinda, our care coordinator. So we just log in to login.salesforce.com and then go ahead and put our username as well as the password. Then click on login. I can see the patients I'm responsible for. Okay, so this is my dashboard. Okay, I can see open task assigned to me, as well as my recent activities on the far right. So let's go ahead and click on Charles Green. As you may see, there's a lot of information going on this page and this layout. So let's let me just walk you through some of the sections. Okay, so on the left side is there's the patient card wherein you can see like language, next follow-up date, condition, last discharge is about diabetes and all. You can also see the engagement. So you can call, email, and here are some of the upcoming and interactions that we had. Okay, other than that, there's a clinical data over this side. Let's just click clinical data. Okay. So in the clinical data, you can see appointments, electronic health record encounters, conditions, medication, prescription, allergies. Okay. We also have member plans. So for example, of these are like the primary medical plan or does it covers dental? So type of claims. Okay. Then let's go to medication. So here we can see the active medication that the hospital has prescribed to Charles Green. And one of my favorite features is the timeline. So the timeline provides you a view of every interaction that was that we had or the hospital had with Charles Green. Okay, so you can adjust the time and adjust this or make it thinner. Another feature would be the Healthcloud household. So it's a data model that represents the relationship between the patient, Charles Green, or the members, and the people and the businesses participating in their care. We created an appointment for Uncle Charles. So let's go ahead and click on the service appointment. Then you see that the latest one that's created is the back pain. So let's just click on the new or the latest service appointment. So we need to verify the scheduled start date, which is 9 a.m. So in this demo, I will show you how to create a WebEx meetings invite. So if you have a WebEx already, an existing WebEx account, an enterprise WebEx account, you can easily integrate it to Salesforce. So what we'll do is that we go ahead and go to calendar and then let's just create that event. So let's click on new event. Okay, so let's just go to an appointment. So back pain. Yeah. Call. Yeah, let's search for Charles Green.
Ito ba yung mask ko kapag? Okay lang naman.
And changes to 9 a.m. Okay, I guess everything is filled out. So let's click on save. So here in the calendar, we can see the appointment. Then let's go ahead and click on the newly created event. Then we can see here at the bottom. So we have our Cisco WebEx meeting activated here in Salesforce. All we need to do is just click on new meeting and add the meeting password. So let's just say cgreen is the meeting password and then click on save. So what will happen is that it will create a familiar text, this one, wherein you can email this to Charles Green. So you can see here the WebEx meeting. So both of them, Dr. John and Charles Green, can join in that meeting. So there's another tool named Sitecall that we can use for as an alternative to a video call here in Salesforce. I just received Dr. John's Sitecall video link. Okay, I just opened my email and received a Sitecall link. So let me go ahead and click on the Sitecall link. Earlier, I've already installed Sitecall over my phone, so you need a Sitecall application for it to work. And then let's just click and see what will happen. So there you go. Okay, so I'll just try to mute. Okay, hi, Dr. John. Okay, okay. So earlier I showed you how it would look like in the phone, in your mobile phone. So right now I'm showing you how it would look like uh, on the screen of the doctor. So as you can see and notice that there are some remote controls that it that can be done. They can turn off or reverse. So we can reverse it, like switch the camera, and I just switch it back. Yeah, and record and provide a quick snapshot. So yeah, that's for Sitecall. Okay, so for the last demo, it's the field service lightning. So what you see here is the actual console or the mobile app for field service. So if you remember, the last demo flow would be we will be scheduling a physical therapist to visit Uncle Charles Green home. So let's just go ahead and so as you can see, there's maps. You can actually provide optimization, route optimization if there are several appointments there. So for now, we only have one appointment. And then let's go ahead and change the status. So we can change the status to new, assigned, in progress. Let's just say in progress and we click on save. And then after the session, we just change the in progress into completed. There we go. And you can also create like a service report, what happened, any feedback. So yeah, so that's it for field service. And this ends my demo. Thank you very much.
Thank you, Tony. So it's a combination of recording and live for everyone's information. So at this point, we will now move on to the next part of our program. I'd like to call back on screen our esteemed roster speakers to join us for Q&A segment. And for those who are here on the call, I would like you to join us and be part of the discussion by keying in your questions via the chat box. And I actually see one question already from the recent demo that Tony showed us. So it says here, will the video call work via Chrome or is it only via site call?
Uh, via Chrome for the desktop version.
Mm.
But for the mobile version, you actually need to download the app. So, but it can also work on the Chrome browser in the mobile also as well. Yeah.
All right. Thanks, Tony. I hope Lale and Tony was able to answer your question. Um, I also have phone in question here. Uh, what is the business model of Health Cloud and the telehealth solutions? Is this subscription based and how quick is this to set up? Medyo marami lang yung tanong. Three questions. So business model of Health Cloud and telehealth solution, is this subscription based and how quick is this to set up?
I can take that, Nikki. So yeah, Salesforce has always been a subscription-based model, because of its software as a service nature. So there's nothing to like install in a server or anything like that. So it's purely cloud-based. So it's always going to be subscription-based. And in terms of deployment, it truly depends on the scope of work for each customer. So it varies, no? So we try to make it as personalized as possible. There's no one standard deployment across all organizations. So it really depends on what the actual I guess requirement of each organization would be. So it could take a couple of months or to like perhaps even less than a year, depending on how complex um, the, the the deployment would be.
Okay. Thank you, Nino. One more question from Matthew. Maybe I'll receive two more questions because of time. May I ask about the payment method?
Okay, I'll take that as well. So in terms of payment method, are you referring to like how to pay or what um, the billing is? 'Cause normally, when it comes to Salesforce licenses, this is billed on an annual basis. So since it's subscription based, it's an annual recurring billing. And then with regard to the deployment services of EPLDT, that is usually a one-time charge that's done at the start of the deployment.
Yeah, right. So it really depends on what is the payment method you prefer. Maybe we can tackle that offline with Matthew. We'll just get your information. Maybe one last question in the interest of time. Can Salesforce integrate with other hospital systems?
Oh yes, definitely. Salesforce is highly integratable with anything. So and EPLDT has that capability, to I guess not only implement and deploy Salesforce for an organization, but make it work with the different applications that the organization already has. So in this case, like, for instance, a hospital would already have its HMS or hospital management system. So Health Cloud can definitely integrate with that. And the EPLDT can make that part of the deployment services. So integration of those systems as well as migration of data if necessary. I think
All
we have
right.
another question.
Hello.
Someone's raising their hand, so I think we have another question here.
Hi, Ray. Go ahead, Ray.
Okay,
Hi,
go
Ray.
ahead.
Yeah. Good morning. Thank you very much. My question is, I was browsing on the pricing of Salesforce last night. How do you price it by user? How many? By is it by user?
Yes, the pricing for Salesforce licenses is by normally by user, per user per year. Um, and there are instances where the pricing becomes a usage-based model, depending on what kind of license is deployed. So for Health Cloud, it's really per user per year. But with components such as Community Cloud and other special components that can be integrated, there will be um, I guess utilization-based charges as well. Um, but it's all about finding the right, I guess, the right mix and the right, I guess, scope of work and deployment specific to an organization.
Okay,
Did I
thank you.
answer the question?
Yes, follow up lang.
Yes.
Because you're the one that you demoed today, lahat ng dinemo ni Miss Samote. How much would it cost for one user? Is there a basic price for that? Including appointment, including the WebEx integration, etc.
Well, with regard to pricing, I think the best people to discuss would be, in terms of discussing this with customers and salespeople. But obviously, we'll have to, I guess, discuss this internally with you guys first. And then, as I mentioned, the pricing is really on a case-to-case basis. There's no standard pricing for every deal or for every configuration. But yeah, it's a mix of many different things. So we'll have to take that on a one-on-one, one-to-one thing, a one-on-one discussion with each customer.
Okay, thank you.
All right.
Thanks, Ray. Let me just check the chat box. One last. I said two last questions, but I see one more here. Uh, can anyone see it while it's still loading on my end? No more. I think Matthew just said
There's
thanks.
there's
Okay.
there's one important one here. Can we
Oh, yeah.
integrate the systems to payment
Oh,
gateways
there.
like Paymaya for online payment for the patient?
Yep. Yeah, I see that. So yeah, definitely. I guess the missing piece here is how would the patients actually go and pay for the consultation and whatnot. So yeah, definitely PayMaya or any other payment gateway can be integrated with the system. It's a matter of I guess scoping for the right information and putting together that solution from an implementation standpoint. It's going to be part of that scope of work. But yes, the short answer is yes, it can be integrated.
Okay.
All right, thank you.
Thanks, Elaine, for that question, and Nino for answering. So I guess if you have follow-up questions, feel free to contact us. We'll be reaching out to you with our contact details. Is it okay if we close this session since we extended already? Okay, all good. So again, everyone, thank you for your time. And to our viewers who tuned in this morning on behalf of PLDT Enterprise, thank you all for spending this memorable morning with us. This was with hashtag One With You, the PLDT Enterprise Virtual Forum for the healthcare industry in partnership with Salesforce. And this has been your host, Monique Dalla Luna. Stay safe, everyone.